Hey, welcome back, everybody. It's time once again for Health Talks with Dr. Trin. The one show, maybe the only show that shows you a path to a healthier life, one conversation at a time. And today, well, I can't remember what we're talking about. Maybe I need some kind of memory testing. Dr. Trin, bring me back to speed here.
Yeah, I'm bringing in an Irish reunion today.
I love it.
Yes, the O'Neills and the Roberts.
That's
and
right.
So we're going to talk about a very important topic today, and it's regard to the importance and the need for memory assessments, especially in light of these new medications that are coming out and FDA approved and things of that sort. I know a lot of folks will be asking, am I a candidate for this? And it always starts with, do you have a memory issue? We have a gap today in medicine in that memory assessments aren't done routinely or consistently at the primary care office. And part of that reason is because, you get your 10 minutes with your doc and nobody even thinks about the memory or have time for it. And this is why we brought Tom on today, the CEO of a national organization called COGNIVUE, and a very important solution to the gaps we have today.
And we don't just have COGNIVUE on, we have Thomas Patrick O'Neill himself.
Yes.
My grandmother always, to emphasize, we got to meet the so-and-so himself. This is like the real deal.
Could have done this on St. Patrick's Day.
Yeah. We can't believe it. We got Thomas Patrick O'Neill himself here today. Yeah. Right. All right. So tell us again what COGNIVUE does, Thomas, and tell us how you got into this.
Yeah. And thanks, Paul. And thanks, Dr. Trin. So COGNIVUE is the first computerized test of cognition. And to put it really simply is we are a memory testing technology. And we make it simple and fun for patients, for consumers to do, and it really delivers a really interesting report to not only the person taking the test, but something that their doctors can use too to really identify if there's an issue at that time. And I think it's, Dr. Trin mentioned it. It's more important now than ever before, and I'm sure we'll get into what's coming in the market that drives that. But it's something that, in my mind, and I think in Dr. Trin's mind, and probably everybody that's touched brain health in some way, shape, or form, it should become the standard of care within healthcare to screen every patient for their brain health.
So remind us, Dr. Trin, the earlier conversations we've had, the many conversations we've had about up till now, the difficulty in assessing whether or not you've got any sort of memory loss. It's very subjective. It has been up to now. Is that what this is aimed at correcting?
There are multiple barriers to doing a memory assessment on a consistent basis. The first barrier is that most folks think that memory loss is simply normal as you're getting older.
Right.
It's like, of course, I'm forgetful. I'm in my 60s, 70s, and 80s. Why should I even bring it up? I'm just old, so I'm forgetful, right? That's the first barrier, is a misperception that memory loss is simply aging and that you don't need to bring it up to your doctor's attention.
Right.
The second barrier is that there is so many other competing issues when you only have 10 minutes with your doctor. Mm-hmm. Right? Those competing issues is, why am I here? What's my chief complaint? And then he or she is reviewing your medications, putting in your referral, talking to you about a specialist. And
where's the time to talk about your brain health? Right.
Where's the time to talk about your memory? And by the way, why even talk about it? Because we think it's part of getting older,
Right.
right? So time limitation is a huge issue. The third issue is expertise. Who is trained to do a memory test, right? Other than a physician who is trained, who has limitations to that training as well. There's not enough neurologists going around, psychiatrists, neuropsychiatrists. Who is actually trained to do a memory test? And obviously, if you're not comfortable in doing a memory test due to the lack of training, it just won't be done. So these are all major barriers to assessing our memories and our cognition. And as a result of that, we are not catching the diagnosis of dementia or Alzheimer's early enough in the game.
And talk about the need for a standard. Maybe Tom can go address this one, because what I understood is it is pretty subjective. I'm kind of asking you some questions, and I don't know, have there been standardized tests that you take, and does everybody know how to use them?
Yeah, Paul, so first off, it's a great question, and I agree with everything Dr. Trin just said. I do think that there are standard tests. They've been around for 30 or 40 years, but they're a paper and pencil test. And the challenge that those paper and pencil tests bring to the process is they're administered by a person. It could be a nurse, it could be an NP, a PA, it could be a doctor. It is also scored by them, and not that they're not brilliant, and they're great clinicians. They want to do the right thing for their patient, for sure, always. The challenge is that every single person brings their own human error, variability, and bias into that process. And I think that's one of the bigger challenges is as we transition from this 30 and 40-year-old paper and pencil test, neuropsych test, memory test, to something that is more standardized. COGNIVUE is a good example where we have the same intro video that every single patient gets so that they hear it the same exact way. We try to remove as much of that human error and variability and bias out of that. And then as they go through our assessment or our test, it is self-administered and it's self-scored. So it really takes much of that out of the mix. I think to add to Dr. Trin's comments, that I think has been the challenge of making this really the fifth vital sign, if you will, is there's three things within a primary care's office, in a family practice's office, is patient flow, like Dr. Chin said, it's 10 minutes. They only got so much time with the patient. And it's not the patient that's going to do well on the test. It's the patient that may need a 30 or 40-minute conversation, which is going to blow up the day. But the second thing is payers, the Blue Crosses of the world, and they're all of them. I don't mean to just focus or center on one, but they all make it very difficult for primary care to get reimbursed for true cognitive testing. They include it in the Medicare wellness visit, but what happens in the Medicare wellness visit many times is the doctor will do a mini cog, which is like a 2 or 3 minute. And it's really more because they're checking the box than they're really doing a brain health assessment. Dr. Trin, I think, would agree. So I think that's the second thing. Payers make it difficult. So if you're a doctor and you're going to spend that time doing it, now it becomes difficult to get reimbursed for it, for your time. And the third thing is, and this is going to change soon, and why I think Dr. Trin invited me on is there was no prescription. There was no true intervention that could be implemented in that mild cognitive impairment phase to slow the progression to before it becomes something more permanent like dementia or Alzheimer's. So those are the three things that I think we run into challenges in that frontline primary care, internal medicine, family practice level. Would that be fair, Dr. Trin?
Absolutely. That's, in talking with my colleagues about memory screening, many of us, our thought process is, why should I even look when I know the prescriptions I have don't work well? When I don't have a treatment, why go looking for a problem? And that's a generalized, but definitely a conversation among physicians that occurs all the time. If this medication doesn't work, if this prescription doesn't work, why go looking for a problem?
Yeah.
So imagine if we felt that same way about heart disease. If we said, if we did not have an intervention, if we didn't have a medication, if we just said, yeah, he or she might have heart disease, but I can't help him, so why am I even going to check it?
Well, Paul, I'll tell you, Dr. Trin, he beats this drum really, really well, and he's an unbelievable advocate for this. But when you think about, and Dr. Trin will appreciate that I recall all this from all the times I've heard him talk about it, is dementia and Alzheimer's is a multifaceted systems issue, right? So it's inflammation, circulation, and toxins. And so to your point, there is a circulation issue component there. So we got to make sure the doctor has to make sure that they're taking care of high blood pressure, cholesterol issues, whatever it might be. But there's also other issues that they need to take care of. This is not going to be a one drug fixes everything. That's why, and Dr. Trin and I have been talking about the modifiable risk factors for years, because the modifiable risk factors of diet, exercise, lifestyle, mindfulness, hearing, vision, all of these things have an impact on a person's brain health. And that's what we would use and leverage to empower the patient prior to the drug that we expect to get approved soon. But I think it's got to still be a total conversation about total health, diet, exercise, lifestyle, as well as medications that can improve and slow down the progression of the issues that happen within the brain around the protein buildup in their brain.
And if we could get this early enough or earlier, wouldn't we have a higher chance of stopping it, slowing it, making it, I don't know if we can ever make it better, but it seems like we just wait until it's so obvious that you can't miss it. They're really out of it. They're really demented. They're really, it's too late at that point to do anything about it. And then how does that affect the rest of the patient's healthcare? My late mother had Parkinson's, which led to dementia. I'll tell you, the dementia made everything difficult. Made talking to her difficult, taking her pills difficult, getting her to walk difficult, getting her to go to the bathroom difficult. It magnified everything. It's hurried up her decline and eventual demise or eventual death because she didn't do anything else after that. Talk about that. How it's a magnifier of all these other problems.
Yeah, I think, Paul, even beyond that, so they're projecting it's going to be $1 trillion cost to the health system by 2050. Wow. But that doesn't even take into account the cost and the burden on the caregiver. You just mentioned you being the caregiver, and beyond the burden, which comes with a cost, with depression, with anxiety,
with a higher risk of death for the caregiver because of the stress.
It does, and there's also this component. We've done the research on it, and we call it the worried well. So they're like you've taken care of mom or dad or grandma, grandpa, aunt or uncle, and you've seen that they have dementia, Alzheimer's, and you're starting to worry now. Even though you're fine, you feel fine. It takes 20 or 30 years for these plaques and tangles to build up in the brain to cause some of those observable issues.
Right.
And so I think I'll lean on Dr. Trin being the physician and the expert, certainly in this space, is the earlier we catch it, the better.
Absolutely. An ounce of prevention, right? It's worth a pound of cure.
So doesn't, and I'll pick on Blue Cross because I'm a Blue Cross member and I believe in Blue Cross. I think they're a good program, but Blue Cross and others, or Medicare as a government program, why don't they see the importance and therefore reimburse and encourage doctors to do this early?
So I'll give you my perspective, and I love Dr. Trin's as a physician. I think it's a couple of things. I think they're always looking to manage costs, right? So I think that's what they try to do, is manage the cost of healthcare, and so they do it, I think, with good intent, good purpose. I don't want you to think that they're bad people. They do it with good intent. I think the challenge becomes when there isn't a prescription, they're going to say to you, I already counsel my patients to eat right, to exercise, and to take their medications. What I would argue is doing the COGNIVUE or any digital test is an inflection point. So as an example, Dr. Trin, I didn't start taking my Lipitor until I saw and I didn't start watching my diet really in regards to cholesterol until I saw my cholesterol numbers. So I think my argument back to them would be, this is an inflection point for them to empower those patients to actually do something, see it, and realize there's something more there. The challenge I think they have is they look at it and go, there's a relatively free mini cog, 2 or 3 questions that doesn't cost them anything, and they can check that box that they've done something, or even something longer like a MOCA or an MMSE, which are the longer 10, 15, 20-minute paper and pencil test. But the reality is those still have the issues that we talked about earlier in this call, earlier on the podcast that causes challenges. So I've had those conversations with the payers, and generally they say we already offer it as part of the annual wellness. We already counsel our patients. So
but do they
prioritize
prioritize it, Dr. Trin? I'm hearing no. I'm hearing that they prioritize things that are immediate. They prioritize things that there's a pill for, and they prioritize things that are quick and easy. And this is none of those. There is no pill. It isn't quick and easy, maybe until now, and it's not something that shows up immediately here.
Absolutely. Because dementia is a long-term, multi-year progressive disease, it's not something where you're going to see within 2 months, right, a change when you activate your lifestyle changes and things of that sort. And as a result of that, it doesn't take as much of a priority. Although I must say that that Medicare over the years have put an emphasis on this. They now have the last few years, the Medicare Cognitive Assessment and Care Plan code that pays for doing a cognitive assessment and care plan. But that specific process is a 50-minute process. You spend a full hour with a patient, which a regular primary care physician do not have. So even with that emphasis put on Medicare, it doesn't fit into the flow of a regular doctor's office, spending an hour with a patient for that.
But am I correct in my view, though, that mental health magnifies whatever other health problems you have, in that you stop taking your pills, you stop moving, you stop doing all sorts of other things, so you stop talking and communicating, and all these things become difficult then to help a patient. Right?
Absolutely. There's clear data out there that if you have dementia or Alzheimer's, your healthcare costs is obviously higher than those without dementia, because you're bouncing back and forth to the hospital all the time due to forgetting to take your pills and your meds and these other complications. Absolutely.
Yeah, I think, Paul, one of the other things to think about when you're talking about payers, I think they're also very short-term in their focus, right? They're public companies. They're working towards their bottom line, and we know that they're not patients, but they're participants or their clients, us, that we move between payers every 3 to 5 years. So when you're talking to them about a disease state that may not impact them with that individual for some time, but they're going to have to take on cost of that, you and the three of us can agree that doesn't make long-term sense. But part of it is what they're trying to manage to their quarterly numbers as a public company.
But how sad is that? There's a stat I never really thought about. So if I'm going to bounce around and change my carrier every 3 to 5 years and add some dissatisfaction and entice them to do something different, if I'm really going to bounce around and do all this, then I'm just not going to worry about that 5-year, 10-year problem. I'll worry about, because I'm not going to have to pay for it in my probable life with this client here. Wow,
Yeah,
how sad
and
is
again,
that?
I want to be that's exactly how I'm explaining it. But I also want to be clear. They really are good people. They intend to do the right things. They put the programs in place. I think it's just a lot of complexity to the process, if you will, and how you manage a patient. And that's where I think even at the hospital level, you have integrated systems and you have your non-integrated systems, and there's positives and challenges with each one.
Right.
And I think the more we can, and Dr. Trin is the amazing Pied Piper of this brain
He
health
really
issue.
is. Yeah.
Is the more, and he's out talking about it 200-300 times a year, literally building the awareness around the country, around the world. And the more we can get converts and advocates like Dr. Trin, the better off we're going to be as a human race, but also just in our brain health.
I got to drop off for 1 minute because I got somebody at my door here. I'm going to let you guys carry on. I'll come back in
Yep.
just a minute
Yeah.
here. So
Absolutely.
No worries. Yeah, and definitely agree. I think this has to be grassroots. Once we educate our average patient or our average person walking around that there is a lot that can be done with lifestyle, with nutrition, with diet, to bend this curve, and especially at the early stages, then folks will be asking, what is my brain health like? And should I get a baseline at least to see where I'm at today with my memory assessments?
Yeah, Dr. Trin, remember before COVID, when people still used to go into the office for work, we did 52 employer health fairs with COGNIVUE.
Wow.
52. And in every one of those, they generally last between 3 and 4 hours long. There's 20 vendors or so that's, are in the cafeteria or in the lobby area. We had 4 of our devices there.
Right.
In every single instance, not just 1 or 2, in every single instance, we had to stay an hour and a half to 2 hours longer at every one of those events because we had a waiting list of people that wanted to take it. So to your point that you just made is that absolutely I think if there's a belief that they don't want to know about their brain health, there might be a small subsegment that doesn't, but the majority of people, I'm telling you, they really do want to know. And that's why, I mean, I've been at your presentations. I've seen them online too. You pack community centers, you pack churches, you pack gyms in that grassroots effort.
People want to know.
Yep.
People want to know. They want to be empowered.
Yep.
Right. We want to be empowered to make a difference with our own, trajectory of our own health and our own brain health. And it's providing that education to empower folks.
Yep.
Once they're educated, then who wouldn't want to know where they're at with this? And it always starts with a baseline memory assessment that can be followed on a yearly basis or more frequently if needed. And it's a start to assessing if you need any potential medication that's coming out in the FDA, right? We got lecanemab and donanemab down the road and other mAbs that will be down the road. But we know that one pill or one infusion isn't going to cure you. Yeah. Which is why we have to take this in our own hands. And that's where the lifestyle and activities and all that come in.
Dr. Trin, I don't know if you recall. So when I took over this role 5.5 years ago running COGNIVUE, I called my parents, who thankfully are still around. They're both now 79, but I called them and I said, hey, I'm going to be the CEO of COGNIVUE. I want you guys to both take this computerized test. You have cognition. And my mom's like, absolutely. And my dad's like, not a chance. and I asked him, I said, well, why? And this was a big insight for me early on. And it's what you just said, which is education. Is my dad said, I already know I lose my keys. I forget why I walked in a room. So I know I already have early dementia. And I go, well, if those are if that's the litmus test, then we all have it. I said, would you be surprised to know that, diet, exercise, lifestyle, sleep apnea, because I know he has had sleep apnea his whole life. I listened to him on the recliner, right? Sleep. So And it was one of those aha moments for me and for him that there are other things from a lifestyle standpoint that he could do that would improve his longevity of his brain health. And so we ended up getting him to do the test, and he did just fine. But I think that was, to the point you just made, I think there's a big educational component to it.
Huge. So why COGNIVUE when there are other ways to test your memory, whether it's the mini cog or the MMSE? Why COGNIVUE? Why does that? Yeah.
Yeah, no, I think it's a great question. I think there's a few different things. First off, we're clinically backed. So as you know, we've had thousands and thousands of patients through studies. We've had a few 100,000 people take the actual test itself. So it's clinically backed and validated. I think that's what you always want to make sure first and foremost. The other things are, remember I mentioned earlier that it's self-administered, self-scored. So we remove as much of that human error and variability and bias out of it. It also, we're very different. So there's no question and answers. It's 10 exercises in 10 minutes. And by exercises, the only thing you're doing is working this little, what we call the COGNIVUE, a little joystick. And that's all the interaction you're going to have. What's amazing about our technology, I think, is that little joystick is actually measuring your motor skills and adapting the rest of these exercises to your motor ability. And so we also then measure your visual acuity and then adapt the rest of the subtest to your motor or to your visual acuity. And the reason being is we don't want to test your motor skills and your visual acuity. We want to do as best as we can is to isolate your memory, right? And isolate your brain health. And so we take you through the 10 exercises in 10 minutes. And I think that the simplest way to explain it is we've surveyed a lot of people after they take it, and they've also taken the paper and pencil and they're past the MOCA or the MMSE. And we ask them, what do they like best about it? And they say it feels like an arcade game. It feels fun. They don't feel like this. Listen, if you ask any adult if they want to take a test, my guess is most of them are going to first think question and answer, and most of them are going to think, I don't want to do that. Because it's, I've heard them say to us, I don't want to take an IQ test. It's not what it is. It really is trying to identify some of those memory challenges you might have. So we know that patients enjoy taking it. So those are really the reasons why I think if you're going to go as a patient and ask your doctor, then ask your doctor to go check out COGNIVUE.com. If you're a doctor and you want to look at it, drop us an email, drop us a call, and we'll get you a device to try and get some comfort level, or reach out to you and we'll give them your perspective as another physician.
Right. So you're gamifying.
Yeah.
You're gamifying memory assessments, which typically are scary to folks, right? Yep. Am I going to pass? Am I going to fail? Is this going to make me, am I doomed? So you're taking something that's typically scary, a scary test, and you're making it like a fun little arcade event, which is amazing to do that.
And I think we almost, I think I'd love your perspective, but I almost think we don't do ourselves the right level of service by comparing ourselves to a MOCA or to a mini mental status exam, because we get so much more data and better sensitivity, specificity, and retest reliability, which sounds like a lot to you, I'm sure, to the viewers or to the listeners, but it's just saying that we get a lot of information that really helps us, not really us, but the doctor, get a better view of your memory and your brain health, and do it in a way that is fun, like to your point, the gamification.
Right. And the other thing that stands out to me with COGNIVUE is that I can't just take an MMSE and bring it out to the community and just offer it to anyone in the community, because I still need that human person who specializes in MMSEs, who's been trained in MMSEs or MOCA. I can't just spread and and expand that, that memory assessment. Whereas at COGNIVUE, it's different. You don't need a trained psychologist. You don't need a trained physician or an NP or PA to go out to the community and administer this. It allows you to really expand beyond the requirement of a trained personnel who's been trained in the psychological testing.
Well, I think you make a great point, Dr. Trey, because what we haven't talked about is I have two devices, right? Two technologies. One is COGNIVUE Thrive, which is more that screening device that you're talking about, which you can do in those either non-MD or more clinical, less physician settings, optometry, audiology, retail pharmacy, at the community church, whatever, right? And then you have the other one, which is COGNIVUE Clarity, which is more of a 10-minute assessment, and it gives a lot more detail to the physician so they can make some deeper decisions, or send you on for some additional work.
Right. And it's so much more than testing memory. Believe it or not, I have a trainer, and he teaches a class at a senior living retirement area.
Okay.
He has an exercise class twice a week, Tuesdays and Thursdays. And so we brought the COGNIVUE there, and we did testing on at least 10 plus folks who have just signed up for his training class. And so we're looking now, not just memory, we're looking at reaction time, processing speed, because this is all linked to, if you're going to take an exercise class, is it going to help you strengthen yourself, perhaps improve your reaction time and processing speed to reduce your risk of falls?
Yep.
And so these participants who are exercising, they volunteered to do the COGNIVUE just to kind of see where they're at. And later on, they're interested in rechecking the COGNIVUE test to see if they have improved in that. And so it's got multi-purposes other than memory. Yeah. And it makes it exciting.
Yeah, we work with Dr. Richard Gans out of the American Institute of Balance, and he does a lot with that vestibular, that balance component. And it's tied to cognition or your brain health. And so we do, like you said, I think whether you're talking about memory or things like concussion or traumatic brain injury or vestibular balance, I think there's a component to all of those and around cognition and brain health. And so I think the more we can, I say it's like the fifth vital sign, the more we can just get it as a normal part of when you're bringing in a patient. And I know you do. And so when I reference you, I'm not talking about you, but your fellow primary care family practice colleagues, the more they can do that and make it part of their regular routine, I think the better off everybody's going to be.
I love that fifth vital sign. Yeah. And we should you should trademark that fifth vital sign, COGNIVUE, right? COGNIVUE fifth vital sign, because
I like your bend the curve. I like the bend the curve. We're gonna
yeah.
Dr. Trin, do you want to give us some idea of what just happened this past Friday with regards to the FDA Advisory Board's decision?
Absolutely. There is a medication from Eisai Biogen called lecanemab. The short name of it is Leqembi. The FDA gave accelerated approval in January, which is different than a full approval. But the date for the full approval is coming up in July, early July. So typically, before the full approval date, the FDA typically puts together an independent committee of specialists in the world of Alzheimer's and brain health, just to kind of give their thoughts on should the FDA approve or not approve this medication. And last Friday, that committee met and gave a unanimous recommendation to move forward and fully approve lecanemab. So that's huge news. that's huge news. That is very different news from a previous committee that made a recommendation for aducanumab, which was I don't know, a year or two ago now, and so it looks like they're heading toward a full approval of this medication by Eisai Biogen partnership. And once this news comes out, folks are going to wonder, is this medicine for me? My memory isn't that great, or I have a family history, right? How do I qualify? And it always starts with an initial memory assessment to see if you're a candidate or not, potentially. It always starts there, which is why this issue is going to be in the forefront. It's going to be in the limelight of memory assessments. Who's doing it? Who's not doing it? Is it being done now consistently, which is not? And how are we going to get this done throughout the country when patients are asking this question, is this medication for me?
We can't hear you.
There we go. I'm back. I got a little diverted there for a second. Let's remind everybody, because you had that people on talking about that first drug, and it was controversial because the advisory committee didn't advise to go forward with it, but there hadn't been anything in 20 years, so they either under pressure or under desperation, they said, let's try it. And the problem, the fear was it really only applied to a handful of people, a small selection of people with Alzheimer's, and it was very expensive. And so the fear was they were going to overprescribe it for everybody, and this would bankrupt Medicare and all this kind of controversy that came with it. Talk about the new drug, which has a similar sounding name. Does it have a similar small select group of people it helps, or is it a wider group that it deals with?
It's in the same family of medications, which is what we call a monoclonal antibody. So what these medications are, whether it's aducanumab, donanemab, or lecanemab, these are antibodies that are designed to go up to the brain and find that beta amyloid. The protein that is associated with Alzheimer's, right? I no longer say the protein that causes Alzheimer's. I'm saying the protein that's associated with Alzheimer's, because we're still debating the chicken versus the egg, right?
Right.
But we know that this protein is formed. So the plaque is the last step of that protein formation, and when it first comes out, it comes out as a monomer, it's APP, and then it kind of binds, and then it goes through these protofilaments. And so there's several steps to get to the plaque itself. And so these meds are binding at somewhere along these steps, right? Somewhere along these steps. So, for example, lecanemab doesn't bind to the final plaque. It binds to the steps before the plaque is formed, right? And so somewhere along this process of becoming a plaque is where these antibodies bind to prevent to highlight the presence of beta amyloid to the immune system. Because once the immune system is alerted by the binding of the antibody to the beta amyloid, once the immune system is alerted, then the process of clearing up, right, of removing
because previously, in years gone by, you and others seemed to suggest it was the plaque. When it finally built up the plaque, that's what prevented the neurons or whatever from transmitting. That's what made the brain break down. But now you're saying if we can get to it sooner, maybe there's a way to not just prevent the buildup of plaque, but maybe the plaque itself is only the final stage. Maybe there's other dangers along the way here.
The plaque is the final stage, and these meds are designed to remove plaque. It's really your immune system in removing plaque, but these meds highlight the plaque to the immune system so that the immune system can do its work.
So does it work for everybody, or is it like that original one that only really had a significant effect on a significant few? that didn't really seem to work across the spectrum. But if you had something special, this was for you. And therefore, if you prescribed it to everybody, it wouldn't have much effect.
So the clinical trials has a scope of who to evaluate the medications on.
Right.
And that scope where it has shown effectiveness is in the mild Alzheimer's category, and the category right before you get the diagnosis of mild Alzheimer's, which is called MCI, mild cognitive impairment. So these two categories, mild cognitive impairment and mild Alzheimer's, is where the scope of this medication lands. It is not designed for moderate or severe Alzheimer's. It is not designed for those who are the worried well or who have concerns with their memory, but their memory test was normal, right? It's not designed for those folks. So it is a slim category, and it's a category that unfortunately is missed all the time, because when you have mild Alzheimer's or when you have MCI, you're blaming it on aging, right? And so you miss it until it becomes more serious, and then by the time it's more serious, you're already at the moderate stage when you're diagnosed.
And this drug won't work then. So it's not too, because that's the hope. That's the simple hope everybody has. Yeah. Like with heart disease, I've got buildup of plaque in my arteries. The blood won't flow. Go in with a little scrub brush, go in with a drug, clean those arteries out or bypass them altogether, and presto, my heart's back to working again. We want to do the same thing with the brain. If there's plaque that's built up, go flush it out or bypass it, and let's get back to business. This is not that. This is not the magic cure that reverses the buildup of plaque. It simply prevents it.
I think that, and the data suggests, and Dr. Trent, tell me if I'm referencing the wrong numbers, but for those caught in the MCI phase or in the early Alzheimer's, it'll slow the progression by about 27%. So that's a big deal. And we know that Lilly's drug, at least in their phase 3 trials, was even more significantly impactful to slowing the progression. And if you talk to people who are, who have been through that with loved ones, if you could slow down the progression by 27%, that's a big deal.
Right. Particularly because this might have started later in life, and therefore by the time it really progresses, they've died. I mean, it's this isn't. I guess I'm wondering if people understand when you get a pill, they think it's a cure, that thinks it reverses it. And this is simply something, if you get to it early, in those early stages, can slow it down. Is that correct?
Absolutely. This is not a cure. This does not even improve memory. This is a process where you're going to buy some time. And these medications are not without side effects, right? There's brain bleeds, there's swelling of the brain. They have to be monitored with MRIs as you're getting these treatments. So you got to weigh the risk versus the benefit to find that one patient or to find that group of patient whose benefit outweighs the risk. So it's a detailed discussion that needs to be made.
So if I'm hearing correctly, though, from Tom's point of view, he's a businessman in addition to being a good guy and a good Irishman here. And the business opportunity for a predictable, easy to administer, standardized, early detection, if you're losing your cognitive ability here, any of these, suddenly, if there is a potential to slow it down, then there's an incentive to start testing earlier and a need for a simple way to do this. Is that correct?
Yeah, you're correct. I think that's the biggest thing the gap that we've had within the marketplace is if this, then what? Right. And we're actually identifying now the then what. I do want to make sure, Paul, that your listeners and viewers know, like, this isn't an easy fix, as Dr. Trent said. It's also not a pill. It's an infusion. And that infusion is going to take 1 hour, twice a month at an infusion clinic, and you're going to be monitored because there are side effects. So they're going to want to make sure that, we're really careful and really specific about the patients that get the infusion, get the drug, but then how are they doing on it? The good news is the FDA is always, focused and worried about patient safety and patient health. So they wouldn't put it through if they didn't believe there was benefit to it.
Yes.
And does Medicare potentially going to pay for this? That was the other problem with the drug. We're not sure. Yeah.
We think so. Indications are they will, but we won't know that till after the FDA approves it, which is early July, and then CMS, which is essentially the government body that decides for Medicare, Medicaid, and then subsequently all the commercial payers that you mentioned, that we mentioned earlier, then follow suit with what it is, what the coverage is.
Because this is expensive, I'll bet.
It's not nearly as expensive as the
first one,
as the first one, right? I want to give Biogen credit though, because it's always tough to be the first mover.
Right.
It's always tough to spend the $10 billion to bring a drug to market. And listen, they broke significant ground by doing that, and they weren't successful to do it, but they woke up the world to the need to do it. And their price was high, but their investment was significant, right? And so I think Dr. Trin, what I've heard, and we don't know yet, but I've heard anywhere from 20,000 a year to 26. But understand, Paul, this isn't a forever drug. This is till it clears the buildup or the development of those plaques until it clears it, which is, I think, Dr. Trin, 12 to 18 months, depending. Does that sound about right?
Yeah. And the majority of folks go from a PET positive brain scan to a PET negative brain scan within a year to 18 months, which is good. This is progress in science. But let's not remember the fact that we're not going to cure Alzheimer's necessarily. Right. We need to implement our lifestyle, our nutrition, our diet, our sleep, our exercise. It's one thing to remove plaque. It's another thing to prevent more plaque from forming with lifestyle changes.
And unfortunately, most of us, maybe me included sometimes, I'll eat better and I'll change my lifestyle. But what I'm really hoping for is just a pill to put it all back the way it was, so I don't have to do the dirty work through the years here. Let me live and eat the way I want, and then when I've screwed it up, you fix it.
Unfortunately, the calcium deposits you talked about earlier, it proved to us that there's no pill that's just going to clear that stuff up. So whether it's cardiovascular or cardiothoracic or brain, I wish it was as easy as a pill.
Yeah, take a pill and I can lose all those years of bad habit and bad eating and everything else. Flush it down the drain. Let the party continue here.
Paul, so you can go back to it.
Let the party continue. Yeah, exactly. Well, you party poopers here, you're making me actually do something here. All right, so how do people find out about this? COGNIVUE, is this something they request? Is it something their doctors are aware of? Is it something they need to read up about? Where do they go?
I think we're continuing to build the awareness. They can certainly go to our website, www.cognivue.com. They can we can give them all the information they want. If they can get the information to their doctor can also call or email us. They can certainly call Dr. Trin. He's a big advocate and really our chief medical officer of engagement. So he engages a lot of patients, consumers, and doctors on the topic. So you can certainly reach out to him as well.
And what do you think, Dr. Trin? Have doctors finally accepted that the patient's going to walk in with something off of Google and says, "What about this?" My doctor freaks when I do that. Oh my God, you are playing doctor again here, and I got it. Don't worry about it. But hey, we live in a world where patients are empowered with more information than they ever had. So I can go out and Google stuff. I can go out and listen to a podcast and learn about something. And by God, I'm going to bring it to my physician if he or she isn't aware of this. Are they more open to that collaboration, or are they still resistant and groan when they start to whip out the...
Once this medication gets approved and every patient's at the door saying, "Is this for me?" and the doctor's going to realize, I don't have time to do a memory test for you.
Right.
They're going to look for better ways to do this. And COGNIVUE is that better way. right? It can be done while somebody is waiting in the waiting room, perhaps, before they see their doctor. And so it's going to unload the burden off of the doctor to do a memory test when it can be done by a computer device outside of that 10-minute visit.
So give me a real quick 2-minute version, 1 minute. We're down to our last couple of minutes here. Walk me through, Tom, what happens if I take the COGNIVUE? Do I go online? Is it an app? Do I take a device?
Yeah, no. So it's a medical device, and it looks like a large laptop.
Okay.
So they will either take it at a optometrist, audiologist, retail pharmacist, at a community center like Dr. Trin's talks, or they go to their MD, which will have, I don't know if Paul, if you were on at the time, but we were talking about the two different versions, the COGNIVUE Thrive, which is the 5-minute screening, which is what they get in those clinicians' offices or in other locations. And then COGNIVUE Clarity, which is in the doctor's office. So it's really meant to be either a screening tool or a deeper assessment tool, depending on the location and which one you use.
But it's self-administered. So I
It
take
is self-administered and self-scored.
Do I put on a goggles, or do I just type in answers? Or
no typing, because there's no question and answers. It is all a CogniWheel. It's just a joystick they move around. So it's really as easy as you can imagine for them to self-administer the test.
Wow. Okay. Well,
it's like playing a little video game, Paul, with a joystick.
There you go. I could do that.
Yeah.
Yeah.
And I wonder if this isn't the future of CVS and all these things. You know, we've talked many times that we've never had them on. We'd love to have them on, but the new CEO of CVS, I think it's a woman, has stated publicly they're transforming the chain, and therefore the assumption is others will follow, where they're going to sell less makeup and toys and stuff, all the goodies that you got as you walk to the back of the pharmacy to pick up your prescription. That's okay, but that's not where they want to go. They want to be a health center. That's where you go get your tests for COVID. That's where you go get your tests for, and maybe for this, where you go get a lot of health information. It's a health center and not just a place to pick up your pills and tempt you with a bunch of purchases on the way in.
Yeah, I think you see a lot of retailers trying to, whether it's CVS, Walgreens, Walmart, they're either doing that within their store, in the four walls of their store, or they're doing it by acquiring primary care groups and then integrating them into their process.
Yeah, that's a big change. I mean, my wife and my aunt and my mother, they all, when they'd go get their pills, they'd come home with a bag full of makeup or a bag full of toys or goodies or other sorts of things. I'm tempted to do this because you're waiting around for 15, 20 minutes to pick up your prescription maybe, and you wander the store and buy stuff.
Dr. Trin might be Dr. Abubakar may be a really good person, because she's an independent pharmacy, but she runs the Avant Institute. There are 20,000 independent pharmacies in this country that are generally in rural areas and places where the chains aren't. So she's a foremost thought leader on that topic. Maybe somebody good for the future for you guys.
Yeah. Who was the independent pharmacist you had on who practices North Carolina, but also is a native?
Oh,
that's her.
That's her.
Yeah, that's her. I forgot that she had been on. Yep.
Yeah.
She zoomed in from Kenya.
Yeah. So awesome. I think that's I'm touting your story here for your investor group, but not only is there an upcoming need if this drug gets approved, when it gets approved, people who want to get tests, the doctors don't have the time, maybe don't get reimbursed. They'd much rather you do self-testing here, and then they can evaluate whether you're in that early stage where this might be effective. And this is the movement of all pharmacies and all things to be more of health centers and stuff here. So you're right in the middle of this thing, well-positioned to take off. Are there lots of other companies doing this? Are you alone?
There's 3 or 4 that are at the top, but we all know each other. I don't think we look at each other as competitors, because it's really just about building the awareness and breaking ground as we go forward.
But number one is COGNIVUE.
Number one is COGNIVUE.
Absolutely.
All right, Dr. Trin, anything else to add, or you can take us out?
No, this is great. Highlighting a huge need and a bigger need that's coming up once lecanemab gets fully FDA approved is the need for cognitive assessments, memory testing, baseline awareness of the things you can do to improve your brain health. So we're in the front of this huge wave that's coming.
Yeah. Right.
As this medication gets approved, and so COGNIVUE is going to be here and leading that charge.
And so is Health Talks with Dr. Trin, the first place I've heard to hear about any of this stuff here. So, yeah.
Right. The best.
Appreciate it.
Thanks for coming on, Tom. Good to see you.
Absolutely. Thanks for having me, Dr. Trin and Paul. It was great to see you guys again, and look forward to future conversations.
All right. Well, there you have it, folks. One more reason to tune in each and every time. Don't miss any of them. Health Talks with Dr. Trin, right here in Orange County's only community radio station, OC Talk Radio, streaming live from our studios here at the University of California, Irvine's Beale Applied Innovation Center.